Hey guys, welcome to yet another episode of Atif's podcast. My name is Atif Anparin, and I'm delighted to introduce you to a new segment of solo podcasts. On this week, we're talking about euthanasia, the ethical questions behind it, and how the world has dealt with such a difficult concept. Since this is the debut of my podcast, and this segment of podcasts, I would like you to enjoy my rookie intro that I made specifically for this genre of podcasts. Alright, so first things first, we need to understand or rather know what euthanasia means and how we look at it. For the most part, euthanasia is a topic that is well known and over the last 10 maybe 20 years is something that's well spoken about. A lot of people are aware of it, but I'll touch on it and just revisit what it means. A text a dictionary or a basic loose definition would find euthanasia to be the ending of the life of a patient to limit the patient's suffering, and that's it. That would be a very loose basic definition of what it is. However, the interpretation, or rather to say what it means, differs very differently from one jurisdiction to another. Each country criminalizes it or rather defends it differently to one another. If we are to go to the US, certain states will differ in the way in which they define it from one another. So it's hard for us to, point out and say, look, this is wrong and this is right and this is what it is and this is what it's not. Before we move on to really discuss what euthanasia is and its types and its ethical questions, we need to understand how its exercisers would look at it ethically. And what I mean by that is the physicians or the medical officers. The reason I say this is because a lot of the time euthanasia is even considered an option, a moral option, or as I would coin it to be, a feasible option would be when it comes to patients who are having critical or terminal illnesses that it proves that going ahead with life would give them a much worse living condition. The quality of life would be poor and the quality of life would not be as prolonged as the normal and average life expectancy would be. So that's where I would see it to be. And a doctor is often tasked with going ahead with this very difficult decision to make it or not. And whether you know this or not, it is illegal in many countries to really do certain actions that would purposefully end in the early expiration of a person, right? So where do we draw a doctor's ethical limits and where does a doctor make that distinguishment? We can to pinpoint and find this, or rather to get their understanding, we can look at the four principles or the four medical ethical principles that most doctors learn and have this as part of either their MD or MBBS, which they consider and they make part of their medical practice throughout their practice. So the four would be beneficence, non-maleficence, autonomy, and justice. So we ask the question, right? And we go ahead and we say, look, why do doctors need to follow ethics? Well, fundamentally, we understand that the role of a doctor or a medical practitioner is to be involved with patients and to act in a sort of manner that's acceptable, right? And having ethical guidelines, or rather having laws and guidelines that are based on principles of ethics, allows them to act in a certain way that's acceptable by all. That's how I see it to be. And so first we need to understand what is considered to be ethical, and what we mean by ethics, right? So a broad definition would tell you that ethics is the study of morals, and morals are essentially the standard or the benchmark of behaviors, what we accept and what we don't, the rights from the wrongs. So that is what we would define loosely as morals. Obviously, you're going to find different definitions and interpretations and whatnot, but here's my take on it. Um, in the study of ethics, there are things that we call moral norms, the traditionally accepted moral values. Like, for instance, to not kill a person, that would be a very good moral norm. To not harm, to not steal, those sorts of things are generally accepted, through its existence in history and in cultures and whatnot, right? From that point onwards, we go on to understand that there are certain particular moral norms that are applicable to certain sets of people. For instance, clergymen would have the moral norm of not abusing the power that they have, the popularity they have. That would be something that is a moral norm for them. And like that, a doctor would have the moral norm to be competent and to provide service to patients in a manner where they're trustworthy. Those two would be moral norms that they would have to follow, specific to their profession, right? Um, how we see it for doctors is, and because there are multiple norms, and we understand that a medical profession is meticulous and each action has the potential of ending up either good or bad. So due to that reason, a lot of these are codified through law, through legislation or guidelines or something. And often we see this dilemma where doctors are unable to fulfill the needs, or rather fulfill the potential that's available in these norms that they are supposed to practice, because it doesn't tally along with these ethical principles and guidelines. So that is essentially the dilemma that they face, and that is more or less what we'll be discussing here as well. Now that we have a decent understanding about why they need ethics and why they follow these morals, I think it's crucial that we go through their medical principles to understand how they operate, why they operate the way they do, right? So the first medical principle that I mentioned was beneficence, and this is the obligation of a physician to act for the benefit of their patient. Maybe preventing harm or preventing the death. These are moral principles, or rather principles or ethical principles that they need to follow. This is to not be confused with non-maleficence, which I will get to soon, principally because the definition, or rather the language connoted or related to beneficence is in a positive note, in a positive intent, and it has more along the purpose of promoting their welfare rather than it does to for any other reasons. And when we go to non-maleficence, we see that while it is similar to beneficence, it states that physicians are not to harm patients. While they would have an overall need to benefit the patient, and a way they would do it is to prevent harm. Here the principle, ethical principle they have, is to not harm patients, so to not kill patients, to not cause pain. Those are examples, and they are also, another thing to note is the examples of general moral principles that we follow in society. Apart from non-maleficence, we have autonomy. Autonomy is quite important. I believe that is, in my opinion, the most important principle to be followed, and the one that causes the most confusion, the most problems, and the biggest amount of dilemmas, because autonomy at the end of the day is a person's ability to make a decision for themselves. It revolves around the idea that a competent person needs to have the power to make rational and moral choices, and goes to preserve and exercise self-determination, right? And as I said, autonomy is often a competing principle. You know, respecting autonomy may not often go hand in hand with the other principles, because if you were to take a very simple example, right? A person has gone and had an accident, or maybe has had uh, surgery, right? Surgery, and they need to be administered some form of opioid or a drug like morphine, intravenously, that is through needle, to be injected. Yet they're afraid of an injection. And here you have beneficence versus autonomy. A person wants to have control over their body, and they want to do this by having the ability to determine that, look, I don't want injections because I'm afraid of it. But on the contrary, a lack of injection means it would cause great amounts of pain. So there you see it's conflicting, and that's a very basic simple way. The rational mind would say, look, it's going to pain a bit, but it'll get better eventually. The weight of feeling a lack of pain, or rather to be relieved of your pain, is far more important than uh, you know having an injection. But at the end of the day, this is the basic of the dilemma that one can face, right? So when we talk about autonomy, we also cannot talk about it without discussing the ideas of informed consent, truth telling, and confidentiality. So when we talk about informed consent, we understand principally that to do anything regarding a patient, regarding any procedure that they may undergo, right? There is an ultimatum, and that is the consent of the patient, right? Doctors can't necessarily do anything or rather administer any form of treatment to a patient if they are unhappy with such a treatment. And this is obviously of a patient who we would identify competent, or who is able to make autonomous decisions, right? But this changes a little bit when it comes to people who are not autonomous, and this is often an idea that needs to be considered when it comes to people who've been faced with the question, or rather people face the question or pose the question, apologies, regarding their matter. Look, should we consider euthanasia for sorts of people who are not responsible, people who are not conscious? They are people who are non-autonomous, they're unable to make that decision for themselves. And when it comes to them, right, how do we identify whether or not there is consent to make a certain decision? Often the best form, or the best way it is done, I know that it's done in the English, or rather in the UK. How they do it is, patients have to sign a certain document that states their autonomous decision, or rather what they would like to do in the event that they become unresponsive. There is such a document that they sign, and those sorts of systems do exist. But a lot of the times, if it doesn't, the doctors, and ethically, or rather they need to go back to the ethical principle of understanding the autonomous rights that a patient has, and should try their best to do what the patient might have wanted to do, right? But in the event that a doctor is unaware of it, there is often a proxy, or who they call a surrogate decision maker. And a surrogate decision maker again has the option to take two paths, and that is to use the substituted judgment standard. And that is, as a proxy, obviously they would understand or know what's in the best interest of the patient, and to substitute judgment of the patient, and to reiterate what they would want to do. Or the best interest standard, right, to consider the context and the content and see what makes most sense, the most logical sense. So in the event that the proxy isn't able to make the decision for them, it's often said that the best thing they can do is obviously to follow with this substitute judgment, right? And then we have truth telling. It's a given, there's nothing further to explain in that. And we have confidentiality. Again, confidentiality doesn't really involved when it comes to where a physician has to share information with fellow medical colleagues for the benefit of the patient, and with people, and information can only be shared with permanent people. So those are basic things, right? And the fourth thing is justice, right? The fourth principle that they need to consider is justice, to in a fair and just manner dispense their medical treatment and care for a person. And this essentially comes down to a few points, right? We know that when it comes to a medical sector or medical services, that resources are limited in any form. Time is a resource that's certainly limited. So to dispensate this justice would be given the very minimal existence of resources. There are certain ways they can be just to share their resources equally, in terms of need, according to the merit and according to the contribution the person has made. So those are different ways in which we can be just. And a doctor has the ethical need, or rather the ethical principle they need to follow in this instance, would be to balance it and to find and understand their complete obligation, or the ultimate obligation they have is to be in the best interest of the patient, and to balance it and see what sort of dispensation of treatment makes most sense. So those are basically the four main principles they need to consider. And from that point on, we need to understand that these principles in most instances aren't conflicting, because they act in their own regard, in their own instance, when it needs to be allowed. But as mentioned earlier, these principles are sometimes conflicting, right? What a physician needs to do at that point is to determine what his determined by weighing prima facie obligations, and to see what obligation would be most important, and make that decision, right? That is essentially what happens when it comes to principles that needs to be followed by doctors. From here, now that we understand the mindset of a physician, we can revisit, or rather get to our main point, and that is euthanasia, right? So euthanasia can be done in three ways. One of the ways is actually debatable, in the sense that certain doctors don't really consider it to be the appropriate term, but let me get to it. The first is active euthanasia, second is passive euthanasia, and the third is physician assisted suicide, or physician assisted euthanasia. So if we are to consider what is active euthanasia, that is killing, or rather ending the life of a person by active means. For instance, giving someone a lethal dose of certain medicines or whatever. For instance, you can give, this is based off of an existing case, I'm not coming up with new things, my goodness, that isn't my intention, but from what I read, I am aware that once a doctor had administered sodium chloride, which is salt, with the intention of stopping the patient's heart. So that is active euthanasia. The other type is passive euthanasia, and that is intentional letting a patient die by either withholding or withdrawing their what we call support. That is also considered to be illegal. Active and passive euthanasia, both in most countries, are considered to be illegal, right? So that is what we need to understand. Physician assisted suicide is again illegal in many countries, because assisted suicide is considered to be illegal, right? So let's talk about active versus passive, right? So what we need to understand is that when it comes to the debate of what is the worst of the two, a lot of people often say that, look, passive euthanasia is much worse, much less worse, and they have a reason. The reason revolves around the idea that being involved in omitting is far worse than to be actually involved in the killing of a person. So they put it in two ways: to kill a person or to let someone die. And their whole idea is that if one person is to pursue this active euthanasia, that is to administer certain medicines or whatever, any form that they use in their what we call in their arsenal, they believe that what happens here is that an active decision is made by the doctor to do so, and to end the life of the patient. They see that, on the contrary, if it was withdrawing or withholding, a doctor isn't really doing anything there. He's letting the normal procedure go. But that is their moral stance on it. But I have a very different stance on it, right? If one was to be involved with passive euthanasia, obviously they are taking that decision to withhold or to withdraw, right? We understand that doctors, they take a hypocritic oath. They say that even the worst person, regardless of if Hitler was to come or was to be alive at some point, or maybe a drug dealer, right? Like Pablo Escobar. Even if such a person was in dire need of medical attention, a doctor has taken that Hippocratic oath to protect, or rather to provide their medical service to, regardless of who comes to them. And if a person has done so and has taken such an oath, is it not their duty to act in the best interests of a person, regardless of who they are? And if that is the case, isn't withholding and withdrawing, knowing very well that this would indeed lead to the death of the person, right? Wouldn't that inherently be wrong? So that's a moral question that we need to ask, right? Another one is, can it be better to side with passive euthanasia compared to active euthanasia? And again, this revolves around terminal patients, because this is a question that comes predominantly regarding their issue and what they might face. So if we were to revisit and look at that, we would consider a person who is terminally ill, maybe some form of cancer or whatever. Obviously not a doctor, it's not my forte. Someone who's terminally ill, and we understand that, look, eventually they're going to pass away in the next few years. So if they are not treated, even if they're treated, they'll pass away eventually in 2 to 3 years. And if they're not treated well, they would die in maybe 6 months. And that would be a very difficult, painful 6 months. If someone was to say that passive euthanasia would trump, and that is to withhold treatment, withhold giving them medicines, if that would be the ultimatum, that would be their say, wouldn't it be sort of wrong? It is, I mean, in the sense, we understand that if a person's misery was to end immediately at that moment, right, that would be in their best interest. Why? Because their misery has come to an end. On the contrary, if they were to continue for 6 months, 6 months of grueling pain, it's a very hard to justify saying that passive euthanasia is better. um that is what it is. And I'm going to go back to what I meant about passive euthanasia being a word that a lot of doctors or a lot of people would like to omit, because, as I also mentioned earlier, euthanasia, the concept of where it stands legally, is quite hard to define. uh, Active euthanasia is quite easy to define, because obviously it shows intent. But if we were to consider the instance of providing or dispensating, um, you know, opioids or some sort of drug that we know to make the living standard, or the standard of living of a patient, better than it is, right? We are following beneficence, right? The medical principle of beneficence. On the contrary, we are also aware that you know, the providing of such a drug could lead to the death of a person. And we are, when we're faced with such a question, we ask ourselves, okay, what is happening here? Is what is being committed a crime? And that's where the whole double jeopardy rule comes in. It states that when a person is administered a certain form of treatment in the interest, in their best interest to relieve them of such a pain, and not in the interest to end their life, uh, in such an instance, it's not euthanasia. Their best interest is to prevent a person from undergoing great amount of pain and great amount of suffering. So that is a loophole around it. And coming to a conclusion of ethical questions, I want to reiterate here and tell you that, look, I'm not here to teach you anything. I am not an expert in this field, not a doctor, not a lawyer yet. 3 years more, hopefully, fingers crossed. I hope that LLB comes in time. But I am not qualified for this. My whole purpose of this podcast and the remaining of my solo podcast is to make you think. It's to make you question why we do things a certain way, and to address a topic like this, which obviously isn't touched normally, because we're busy with traditional political debates and political arguments, which hopefully I can get into too. But yeah, that is rather the conclusion of this podcast. And I want to also note that this is inspired, or rather a result of, the ongoing Battersbee case that is the case of a young child named Archie, who, as of right now, has sadly passed away. His condition was that he had suffered traumatic brain injury, um, and the doctors weren't able to, decide whether or not he was to be considered to be brain dead, because a certain test that is to be done, that's the brain stem test, if I'm not wrong. They were unable to do it, and months ago they had declared that he might potentially be brain dead. A lack of cognitive function and whatnot. It's quite sad because there was an ongoing debate about whether or not to pull his life support. If we were to say that euthanasia had a very clear cut definition, and if it is to be illegal in its complete sense, we are fully aware that what happened in court today wouldn't have happened. We are aware that there are multiple segments, or multiple standards to which the court looks at anything. In this instance, that would be the best interest of Archie. And while it is sad, it's also a great learning moment for a lot of us. A lot of us are made aware of the situation. A lot of us are brought into light about the situation. So I'm glad for that reason, and that reason alone. But it's quite a sad news for anyone to hear. And I've been following the news for like the last few days, and it's quite devastating just reading everything from beginning. If you were to read the court documents, just the brevity of the last few days of treatment that a person was going under, then you ask that question: is keeping someone alive in such a forced manner through such uncomfortable, difficult circumstances really worth it? Are we prolonging life, or are we prolonging death? That is a question to be answered. And signing out, you have Atif Anparin once again. Stay tuned, like this on any form of provide, like on Apple Podcasts or Spotify or wherever you're seeing it. Do share this, like this, and if it's on YouTube, do post your comments about what you think about it. Obviously, I'm someone who enjoys constructive criticism, so I'll take that for a fact. And yeah, that's about it. Have a nice day, guys, and learn more about it, read more. That's what life is. We're an ever learning, ever growing population. And yeah, right. See you another time. Bye bye.